Welcome to the Patient Educators Update, where we focus on patient educators and patient education topics in a clinical environment. My name is Chuck Jones, and our guest today is Fran London. Fran is the health education specialist for Phoenix Children's Hospital out in Phoenix, Arizona. Fran has published dozens of articles and 2 books on patient education, including No Time to Teach, The Essence of Patient and Family Education for Healthcare Providers. And that book was awarded the 2010 Book of the Year by the American Journal of Nursing. Hi, Fran.
Hi, Chuck.
The last time we were together, we talked about just patient education in general. And as you know, I'm a big fan of your book. And I was thumbing through it, and one of the early chapters talks about assessment. And I know that's important to you, and obviously you put it early on in the book, so it's fairly important. So can you give us kind of a definition of what assessment is?
Sure. Assessment, first of all, is the thing that most people skip, and it's probably the most important step in the patient education process. And basically, it's finding out what the patient knows before you start teaching.
Well, that's an interesting approach. That reminds me, my wife happens to be a type 2 diabetic, and she has been type 2 diabetic for, 15 years. And I remember on a doctor's visit some years ago, I know what she was in the hospital for surgery, and she had listed that she was a type 2 diabetic, and the nurse came in there to explain to her what she had to do to manage her diabetes with the surgery. And based on what she told my wife said, well, no, that's not accurate, because I have this, and this, and I've already been to my endocrinologist, and I have the extra insulin and this, that, and the other to manage that. So your information's not accurate. And I guess if the nurse had done an assessment, she might have perhaps not started talking and done more listening.
Yeah, exactly. And that puts out another point, which is you save a lot of time if you do assessment. That nurse would have had a lot more time to teach about something else.
Yeah.
She had listened first.
Yeah, totally. And my wife had other questions. She was way more concerned about rehabilitation on some shoulder surgery that she was having. Diabetes is not a problem that she has questions about because she's well managed. She keeps on top of it. And that's interesting. Now, how should a nurse go about doing assessment? Are there some key things that they need to do?
It's easiest to just start with asking, tell me what you know about whatever it is.
I gotcha. Now, if the patient has got a family member there with them, and the family member does all the talking, is that a good thing or a bad thing?
It depends on the situation. If the family member is the only caregiver and the patient doesn't do anything for him or herself, then sure. But in most cases, it's the patient that takes care of himself.
Okay, I gotcha. Well, now once the nurse has gotten the information back from the patient and she has some kind of understanding of what they know, how should he or she apply that knowledge?
There are a couple of things. One is if there are any misunderstandings or incorrect information, it's good to start by correcting that.
Okay.
And clarifying it in a gentle way, but being clear.
Okay, well, that makes sense. Now, should that also kind of direct what they're going to do for the rest of the patient's hospital stay in terms of education, or should they stick with whatever the, quote, plan is at the hospital?
No, actually, you're more efficient if you go with what you have.
Okay.
If you use the same words the patient uses to define things, to refer to things, that helps them understand. And then if you build on what they know, moving toward what you think the plan is, then you're much better off.
Okay. Well, that makes total sense then. So I guess the moral of this episode is that when you say you have no time to teach, if you'll take a minute to assess the patient and figure out where they are, you'll find out that you actually have plenty of time to at least get it started and moving in the right direction to build on what the patient already knows. That makes sense?
Absolutely. And don't waste time talking over their heads or under what they know.
Sure.
And you're just more efficient.
Yeah, that makes total sense. Okay. Well, with that, I think we can go ahead and end this episode, because that just makes a whole lot of sense. And hopefully that was some help to some of our audience members. So I want to thank you for your time today, and let people know that they can find you in a couple of different places. You have your blog, which is notimetoteach.com, and you write there very frequently. And then you also are on Twitter, and you're very active there, and you are at No Time to Teach, all one word. And so I know those are two excellent places to keep up with you. And I think Twitter is the first time I started communicating with you back, more than a year ago.
Yeah.
And I also want to let people know that your book, No Time to Teach, is still available. It's in print and also ebook form, and they can get that wherever books are sold. That includes Amazon, and also through your publisher, p-h.com. And if a hospital is interested in a bulk purchase, they can get a pretty sizable discount on the purchase. Is that correct?
Yes.
All right, cool. Okay, well, excellent. Well, Fran, thanks very much. I appreciate it, and we look forward to talking to you next week.
Thank you, Chuck.
Take care. The Patient Educators Update is brought to you by Synergy Broadcast Systems and MMDS, our video-on-demand inpatient education system for hospitals and medical centers. Education to help patients and their families prepare for success in their home after leaving the hospital. So thanks very much for watching. We'll see you next time.